A lot of people assume that blurry vision is just something you're supposed to accept once you hit your 70s. You wake up and your eyes feel dry and scratchy. You squint at a menu across the table and the words blur together. Or maybe it's headlights at night. They scatter into starbursts, and you find yourself gripping the steering wheel a little tighter than you used to. Here's what most doctors don't take the time to sit down and explain to you. It's not always just old age. The American Academy of Ophthalmology has been clear that after 60, the eyes become significantly more vulnerable to conditions like dry eye, cataracts, and age-related macular degeneration. The National Eye Institute has also tracked a real rise in vision loss among older Americans over the past 2 decades, driven largely by these same conditions. What makes this especially frustrating is that a lot of the damage builds up slowly at night while your body is supposed to be resting and repairing itself. The retina, the light-sensitive tissue lining the back of your eye, depends on steady blood flow and a strong antioxidant defense system to protect itself while you sleep. When that system weakens with age, the light-sensitive cells inside the retina slowly lose ground, and most people don't notice until the damage has already added up. So here's the question I hear constantly in my practice. Why is my vision getting worse? And is there anything natural I can do about it without depending only on drops, stronger glasses, or a surgical waiting list? Here's the honest truth. Eye drops, updated prescriptions, and surgery all have their place. And for many conditions, they're genuinely necessary. But they mostly manage symptoms after damage has already occurred. What the research increasingly shows is that certain nutrients, some of which come directly from the fruits sitting in your kitchen right now, can support your eye's natural defenses before that damage builds up. The best documented example of this comes from a major National Eye Institute clinical trial called AREDS2, which followed thousands of older adults and found that a specific combination of nutrients, lutein, zeaxanthin, vitamin C, vitamin E, and zinc, measurably slowed the progression of age-related macular degeneration in people already at risk. This isn't a fringe claim. It's one of the most cited studies in all of eye research, and it changed how ophthalmologists counsel their patients today. My name is Dr. James Revealio, and I've spent years helping older adults understand what the actual science says about protecting their vision. Not miracle cures, but real evidence-based nutrition alongside proper medical care. Today, I'm going to walk you through 7 fruits that research links to better eye health and exactly how to use them the right way. Before we get into it, I'd love to know where you're watching from. Drop your city or country in the comments below. We're building a real community here, people who refuse to accept vision loss as simply inevitable. One important note before we start. Everything here is educational. It is not a replacement for professional medical advice. If you're experiencing vision changes, blurry vision, or any concern about your eyes, please see a licensed eye care professional before changing your diet or routine. Your eyes are too important to gamble with. And if you want more content like this, our Telegram channel, Dr. James Revealio, has extra guides and updates I don't post anywhere else. Link is in the description. Now let's start counting down from number 7. Number 7. Kiwi. It's small, a little fuzzy, and you probably walk right past it at the grocery store every week. But for aging eyes, kiwi deserves a second look. As we get older, the retina becomes increasingly vulnerable to oxidative stress, the gradual wear and tear caused by unstable molecules called free radicals. Over time, this wear can contribute to the kind of blurry, slow to clear morning vision so many people write off as just aging. Kiwi is one of the more concentrated fruit sources of lutein and zeaxanthin, the same 2 nutrients highlighted in the AREDS2 trial I mentioned earlier. These nutrients accumulate in the macula, the central part of the retina, where they act like an internal filter, absorbing excess blue light and providing antioxidant protection. Kiwi is also one of the richest fruit sources of vitamin C, which research has long associated with a lower risk of cataract formation since vitamin C helps protect the proteins in your eye's lens from oxidative damage. How do you use it? A simple, practical approach is 1 to 2 kiwis a day, skin left mostly on if you tolerate it well, since much of the fiber and some nutrients concentrate near the skin. Golden kiwis tend to be slightly sweeter and less acidic than green ones, which some people find easier on the stomach in the evening. A small, ordinary fruit, meaningful support for your eyes, no pill required. Number 6, watermelon. If you've ever wondered why your vision feels blurry for an hour or more after waking up, this one's worth hearing. As we age, circulation to the retina can gradually slow, and reduced blood flow is a real contributor to that frustrating morning blurriness. Watermelon is over 90% water, so hydration is an obvious benefit on its own. But there's more to it. Watermelon is one of the richest dietary sources of lycopene, a carotenoid antioxidant that observational research has linked to reduced oxidative stress in retinal tissue and to a potentially lower risk of certain age-related eye conditions. Watermelon also contains citrulline, an amino acid that your body converts into arginine, which plays a role in nitric oxide production. Nitric oxide helps blood vessels relax and widen, supporting healthy circulation, including to the small vessels that feed the retina. How do you use it? 1 to 2 cups of chilled, seedless watermelon works well as an evening snack. Skip added salt. Excess sodium is linked to higher blood pressure, and the Glaucoma Research Foundation notes that elevated pressure inside the eye is a significant and largely irreversible risk factor for vision loss if left unmanaged. Number 5, black currants. Tiny, deep purple, and easy to overlook, but when it comes to eye health, especially in low light, black currants have a genuinely interesting research history behind them. Black currants are exceptionally rich in anthocyanins, the deep purple pigments that also give blueberries and blackberries their color. In the eye, anthocyanins have antioxidant properties and have been studied for their potential role in supporting healthy blood flow to the optic nerve and retina. Some clinical research out of Japan, where blackcurrant extract has been studied more extensively than in the West, has looked at its effects on ocular blood flow in glaucoma patients, with promising but still preliminary results. This is an active area of research, not a settled cure, and anyone with glaucoma should be working directly with their ophthalmologist rather than relying on diet alone. Anthocyanins have also been studied for their possible role in supporting rhodopsin regeneration. Rhodopsin is the visual pigment your eyes use to adjust from bright light to darkness, which is part of why anthocyanin-rich foods are often discussed in the context of night vision and glare sensitivity. How do you use them? Fresh black currants can be hard to find in typical American grocery stores. A standardized black currant extract taken as directed on the label is a reasonable alternative, ideally with a small amount of healthy fat or a vitamin C source, since these nutrients tend to absorb better together. Number 4, blueberries. You almost certainly already have these at home. But here's the part that surprises people. Many of us eat blueberries in a way that reduces how much benefit we actually get from them. Blueberries are rich in anthocyanins and other polyphenols that target oxidative damage in photoreceptors, the specialized cells in your retina responsible for sharp focus and adapting to changing light. Years of cumulative UV exposure and normal aging both wear down your eye's natural antioxidant defenses, and blueberries are one of the most studied fruits for supporting that defense system. One notable difference: wild blueberries, the small dark ones typically found in the frozen section, tend to have a higher concentration of anthocyanins than the larger cultivated varieties common in fresh produce aisles. And frozen is nutritionally just as good as fresh, since freezing doesn't meaningfully break down these compounds. How do you use them? About 1/3 to 1/2 cup of blueberries as an evening snack is a reasonable serving. One helpful tip: try to space them out from dairy. The proteins in milk can bind to some antioxidant compounds and may reduce how much your body absorbs, so eating blueberries on their own, rather than in a milk-based smoothie, is likely to get you more of the benefit. Number 3, dragon fruit, exotic looking, visually striking, and genuinely interesting from a nutrition standpoint. If you regularly wake up with tired, heavy eyes, even after a full night's sleep, this one is worth knowing about. You want the red flesh variety specifically. It's rich in betalains, a class of antioxidant pigments that have been studied for their role in supporting nitric oxide production and healthy blood vessel function. As we discussed with watermelon, nitric oxide helps relax and widen blood vessels, which can support better circulation, including to the retina during sleep. The white-fleshed variety contains far fewer of these betalain compounds, so the color genuinely matters here. Dragon fruit is also a good source of vitamin C and contains small black seeds rich in polyunsaturated fats, including some omega-3 content, which has been studied more broadly for its role in tear film quality and overall eye comfort. How do you use it? About half a red dragon fruit as an evening snack. Chewing the seeds rather than swallowing them whole allows your body to actually access the fats inside them. Number 2, goji berries. Bright red, slightly sweet, and used in traditional Chinese medicine for centuries, specifically for eye health. Modern nutrition research has taken a genuine interest in why goji berries are among the richest natural dietary sources of zeaxanthin, even more concentrated than most other fruits on this list. As we discussed earlier, zeaxanthin concentrates specifically in the macula, the central part of your retina responsible for the sharp, detailed vision you use to read, recognize faces, and see fine detail. This is the same nutrient highlighted in the AREDS2 study for its role in supporting long-term macular health. Some smaller clinical studies have measured macular pigment optical density, essentially how much protective pigment is present in the macula, in older adults who consumed dried goji berries regularly over a period of weeks, with encouraging increases observed. This remains an area with a limited but growing number of trials, and larger studies are still needed to confirm long-term outcomes. How do you use them? 2 tablespoons of dried goji berries soaked in warm water for about 10 minutes to soften them works well as an evening snack. Pairing them with a small amount of healthy fat, a few nuts, or a square of dark chocolate may help your body absorb the zeaxanthin more efficiently, since it's a fat-soluble nutrient. Number 1, papaya. It's not exotic, it's not expensive, and you may already have one sitting on your counter. But eaten the right way, papaya targets one of the more overlooked contributors to blurry vision and cloudy lenses: oxidative stress combined with poor tear film quality, both of which become more common with age and with elevated blood sugar over time. Papaya is rich in vitamins A, C, and E, along with folate, a combination that research consistently links to healthy tear film production and reduced oxidative stress in eye tissue. Vitamin A specifically plays a well-established role in maintaining the health of the cornea and the surface of the eye, and a genuine vitamin A deficiency is one of the leading preventable causes of vision problems worldwide, though this is far less common in the United States thanks to a varied diet. Papaya also contains papain, an enzyme best known for its role in digestion, though some early research has explored its broader anti-inflammatory properties. How do you use it? 1 cup of ripe papaya, ideally at room temperature rather than cold, as an evening snack. A squeeze of fresh lime juice adds extra vitamin C, and citrus vitamin C has been shown to improve the absorption of vitamin A from food. 5 rules to get the most from these fruits. Before we wrap up, here are 5 practical habits that can help you get more consistent benefit from any of the fruits we've discussed. Rule 1. Space them out from high calcium foods. Eating fruit shortly after dairy or calcium-fortified cereal may reduce how well your body absorbs certain fat-soluble antioxidants, like lutein and zeaxanthin. Giving yourself some separation. Treating your fruit as its own snack rather than dessert after a dairy-heavy meal is a simple, reasonable habit. Rule 2. Add a small amount of healthy fat. Many of the key nutrients in these fruits, including lutein, zeaxanthin, and vitamin A, are fat-soluble, meaning your body absorbs them better in the presence of some dietary fat. A few walnuts, a teaspoon of ground flaxseed, or a few slices of avocado alongside your fruit is an easy way to support this. Rule 3. Wash gently. Some antioxidant compounds concentrate near the skin of fruits like blueberries and black currants. Gentle rinsing under cool water, rather than aggressive scrubbing, helps preserve more of these surface nutrients. Rule 4. Let refrigerated fruit come to room temperature. This isn't strictly necessary for absorption, but many people find fruit more palatable and easier to digest before bed when it isn't ice cold. Rule 5. Pay attention to timing. Eating a light fruit snack roughly 60 to 90 minutes before bed, rather than immediately before lying down, gives your digestive system time to settle, which can support better sleep quality overall. And good sleep itself plays an important role in your body's general repair processes. Closing blurry vision isn't simply an inevitable consequence of getting older. It's often connected to specific, identifiable processes, oxidative stress, reduced circulation, and nutrient gaps that tend to widen with age. The research we've walked through today, from the National Eye Institute's AREDS2 trial to smaller studies on individual fruits, suggests that thoughtful nutrition can be a meaningful part of supporting your eye health, alongside regular checkups with your eye doctor, not instead of them. Think about reading without squinting, driving at night with a little more confidence, waking up and seeing clearly within minutes, not hours. That's really what this is about. Not just clearer vision, but your independence and your quality of life. I want to hear from you. Which of these fruits are you already eating, and which one are you going to try this week? Let me know in the comments. I read everyone. If this was helpful, hit like and subscribe for more evidence-based approaches to protecting your health as you age. And consider sharing this with someone over 60 in your life. It might genuinely make a difference for them. This is Dr. James Revealio. Take care of your eyes. They're irreplaceable.